Rygiel's Health and Safety Refresher 2021. Our commitment as a leadership team. In Ontario, workplace health and safety is regulated by the OHSA, which stands for Occupational Health and Safety Act, or the Act. Under the Act, maintaining a healthy and safe workplace is a responsibility shared by the employer, supervisor, and the workers. Co-op students, interns, and apprentices are all considered workers. This is known as the Internal Responsibility System, IRS, and it means that we all work together to identify and control hazards and prevent injuries. Our commitment as a leadership team includes rights and responsibilities, due diligence, prevention training, personal protective equipment, workplace violence prevention, hazard, near-miss reporting, accident, incident reporting, early and safe return to work, communication within the organization. Each person in the workplace has duties to keep the workplace safe. The employer is ultimately responsible for establishing the health and safety program. This includes determining the rules for working safely, training workers on the rules and procedures for working safely, providing the right tools and equipment, and ensuring they are maintained. Managing hazards to eliminate and reduce the risk of injuries and illness, appointing a competent person as a supervisor, and taking every precaution reasonable. A supervisor is responsible for training workers on how to do their job safely, enforcing rules including the use of safety equipment, and taking every precaution reasonable. Workers are responsible for following safe work procedures and rules, using the safety equipment properly, reporting hazards and near-miss and injuries to their supervisor. This communication helps supervisors respond quickly to hazards. Workers also support the internal responsibility system by understanding their 3 rights: the right to know about the potential hazards for their job, the right to participate in workplace health and safety, the right to refuse unsafe work believed to be dangerous to their own health, or the safety of a coworker. A worker cannot be threatened or punished for the following laws. This includes reporting a hazard, refusing unsafe work, or cooperating with the Ministry of Labor. What can you do to support the internal responsibility system? Personal protective equipment, safety measures, use and wear PPE, report defective PPE or devices, report unsafe acts of colleagues or the existence of hazards, participate in the identification of workplace hazards, and be familiar with the health and safety program. Employees should not engage in any prank, contest, feat of strength, unnecessary running or rough behavior, or work in a manner that may put others at risk. Due diligence. Due diligence means that as an employer, we will take every precaution to prevent injuries or accidents in the workplace. It also means that as an employee, you will do the same. Take every reasonable precaution to identify hazards to the employer and reduce the risks or hazards to yourself or others. Prevention training, preventing accidents, incidents. One of the most proactive ways to prevent accidents and incidents from happening is to be aware of what they are and to ensure training is up to date and completed on a regular basis. Training at Rygiel related to health and safety includes WMIS training, fire safety training, CPR first aid, proper lifting, emergency planning, pandemic training, NVCI, workplace violence, and a health and safety refresher. Personal protective equipment, Policy 4.3. The use of personal protective equipment, or PPE, has changed amidst the COVID-19 pandemic. We will incorporate the PPE training during the pandemic into this training. Rygiel Supports for Community Living will provide personal protective equipment to all employees who need it. Safety equipment examples. Safety equipment examples are gloves, goggles, aprons, masks, face shields. Personal protective equipment is to be worn where there is a potential risk of an occupational exposure that may be hazardous to the employee's health. It is the employee's responsibility to wear PPE while performing any tasks involving or handling detergent, cleaning agents, blood or blood-borne pathogens, bodily fluids, contaminated linens, items, or surfaces, or anyone who has been exposed to COVID-19 or other communicable diseases. The purpose of protective equipment is to create a barrier and protect against any exposure through the skin, eyes, mouth, or open cuts. Personal protective equipment is mandatory. Gloves are not fully protecting the skin. It's very important that all employees adhere to proper hand washing before and after gloves are used, after handling any contaminated items, prior to preparing food, and before and after eating, drinking, assisting people in hygiene routines, and after using the washroom yourself. For a more in-depth information on this, please see Policy 4.3 on your RHub. Staying safe while working in a pandemic starts with small work habits that reduce the risk of infection for all of us. That means physical distancing when possible, proper hand washing and hygiene practices, staggering shift and meal breaks to reduce contact between employees, measures to keep the people supported safe. We also need clean and safe workplaces. This means thoroughly sanitizing workspaces. At Rygiel, we have some tips on how to stay safe at work while facing a pandemic. COVID-19 can be a deadly disease. Rygiel provides most of the personal protective equipment you need to stay safe: gloves, masks, and sanitizers. Emotional support is available during this stressful time under the Employee Assistance Program. Protecting our mental health is vital. Protecting our mental health is vital, and Rygiel is here to help you every step of the way. Get the facts about COVID-19, basic symptoms, and treatment. Get specific resources to prevent COVID-19 at Rygiel. All of these resources can be found on your RHub. Workplace Violence Prevention, Policy 4.8. Rygiel Supports for Community Living is committed to providing a safe, healthy, and supportive living and working environment by treating each person within Rygiel with respect, fairness, and sensitivity. Rygiel recognizes the potential for violence in the workplace and will make every effort to identify all potential sources of violence to eliminate or minimize these risks. Workplace violence includes any act that causes physical injury or the threat to commit an act that could cause physical injury. Violence in the workplace can come from a physical attack with or without a weapon. Assault is the intent to inflict harm on someone, causing someone to fear bodily harm. Swearing, verbal abuse, any comments that are unwelcome, embarrassing, offensive, threatening, or degrading to another person. Threats can be verbal or written. It is the intent to harm a person or property by an unlawful act. Psychological abuse is an act that provokes fear or takes away a person's dignity or self-worth. Bullying and cyberbullying. Sexual assault is any verbal or sexual advance that is unwelcome. Sexual abuse is the use of a threat or an act of violence to force someone into a sexual act. Near miss is an observation that could potentially lead to harm. Rumors, sabotaging, pranks. You may think something you say or do is a joke, but the truth is, it may constitute workplace harassment. A poisoned work environment is a hostile and abusive and/or unwelcoming work environment resulting from harassment or conduct that ridicules or demeans an individual. Discrimination is a prejudiced treatment specific to minority groups. Every person has a right to a full and equal recognition and exercise of his or her human right and freedoms without distinction, exclusion, or preference based on race, color, sex, sexual orientation, civil status, religion, gender, political convictions, language, ethnicity or national origin, social condition, and disability. Harassment is any behavior that is verbal, physical, deliberate, unsolicited, or an unwelcome invitation that demeans, embarrasses, humiliates, and is known to be unwelcome. Harassment includes words, gestures, jokes, remarks, innuendos, taunting about a person's body, gender, age, marital status, ethnicity or national origin, and religion. Harassment extends to during work hours and outside of work hours if the incident is employer-related. Bullying. Bullying can occur in the workplace, creating a toxic environment for all employees. Bullying is anything that makes a person upset, threatened, humiliated, or vulnerable. It affects self-worth and causes stress. What is a workplace bully? A workplace bully is someone who targets an individual or individuals over a long period of time in a way that undermines their credibility, sense of self, identity, and their self-esteem. Consequences can be depression, not being able to do your job to the best of your ability, anxiety, and a feeling of dread going into work. The consequences of bullying in the workplace affect the target of the bully and the witnesses. Risk assessment. One of the first steps in preventing workplace violence is a risk assessment. These risk assessments have been completed by employees and reviewed. Any identified risks will be put into an action plan to decide how we reduce the risk. The action plan, risk assessment, and the original workplace violence prevention training program can be found in your health and safety binder under Workplace Violence Prevention Training. This training program is reviewed annually and will be shared with employees and the health and safety representative within your location. Workplace violence can be committed by anyone who comes into contact with you throughout your shift. Employees, supervisors, students, contract workers, visitors, families of people supported, friends, unauthorized intruders, and people we support. Reporting and investigating workplace violence, staff and volunteers are responsible to report all acts defined in the Workplace Violence Prevention Policy to their appropriate supervisor, service coordinator, or on-call supervisor. You can call your supervisor at 905-525-4311 Monday to Friday from 8 a.m. to 4 p.m. or after hours at 905-525-4311 and ask to speak with the supervisor on call. You can also ask to speak with them at the main administration office. Staff and volunteers should report all incidents to their supervisor. This report will be made confidential at the employee's request, with the exception of ensuring the safety of others and prevention of reoccurrence. A police report may need to be made at the discretion of the supervisor. What if I'm a victim? If you are a victim of workplace violence, you will fill out an accident incident report. Please provide as much detail as possible so we can support you and investigate the incident. Supervisors will facilitate medical attention as required. They will conduct a full investigation and may need to speak with community agencies or make referrals to our Employee Assistance Program. They will complete the incident reports and the accident investigation with human resources involvement, and they will do a team debriefing. Management will review all incident reports, monitor trends, and will make recommendations for prevention and enhancement to the Workplace Violence Prevention Program to the Executive Director. The Executive Director will review reports of workplace violence and ensure appropriate actions have been taken. For more in-depth information, please see Policy 4.8 on our hub. Hazard Near Miss. Policy 3.3. All employees in Rygiel supports for community living are expected to actively support and participate in our hazard recognition and management program. The procedure. All near misses, hazardous situations shall be immediately reported to the service coordinator, supervisor, or on-call supervisor for documentation and investigation. All employees are responsible to take every action possible to remove hazards on an ongoing basis. Hazardous situation has the potential to cause an accident, incident, or a near miss. A near miss is a situation which could have potentially resulted in an accident or incident, but it did not. Roles and responsibilities for employees. Potential health and safety hazards should not be left until the next inspection. Employees are expected to ensure that any equipment, material, or device is in proper working order. Employees are responsible to report any of the following: equipment defects, missing or defective protective gear, existing hazards, improper practices, all concerns that affect a healthy and safe environment. Those are to be reported immediately. If a hazard is observed or a near miss takes place, but it can easily and quickly be corrected by the person making the observation, it should be corrected. A near miss hazardous form should be filled out and submitted to the supervisor or a service coordinator. If an employee observes a hazard that can be corrected by maintenance, should be reported immediately by the employee to the service coordinator or supervisor Other hazards that need outside intervention should be reported immediately by the employee to the service coordinator or supervisor using the near miss form. Supervisors are responsible for reviewing all reports submitted to them and making sure the hazard is reduced or eliminated. All of these forms and resources can be found in our hub. Accident Incident Reporting, Policy 4.13. Employee accident incident reports are found in our hub. The agency will train all employees upon hiring and yearly thereafter on responsibilities on accident incident reporting. The agency requires due diligence in reporting incidents. Reporting quickly is important, so you can fill out all the details accurately in the report. Proper reporting will help in dealing with the situation and preventing a similar situation. Critical Injuries Policy 4.17. An injury that requires professional medical treatment or results in lost time from work will be classified as an accident. An injury or illness that does not require professional medical assistance or lost time from work, but did require first aid treatment, will be classified as an incident. An illness is defined as any disease resulting from exposure to a substance relating to a particular process. In our hub, you will find the Accident Incident Report form. It's your responsibility if you are injured at work to immediately talk to a service coordinator or supervisor. If you require medical attention, we will make sure it is provided for you. There are times when a report needs to be completed, but you're not sure you need medical attention. An example, if you were assisting an individual supported and you were repositioning them and you felt a pull in your shoulder or your back that doesn't hurt at the time, but it might hurt in the future, an accident incident report should be filled out and you should let a supervisor know what has happened. In the box that says, "Did you seek medical attention or lose time from work?" please check "Unsure" and then see how you are feeling the next day. If you are in pain the next day, you should speak with your supervisor so they know it is now a WSIB claim and can start the process to complete the paperwork. Once the form is completed, please forward it to your service coordinator. Investigations are done, even if there was no lost time from work. Human Resources reviews the report to find solutions to get you back to work safely and prevent similar injuries. Early and Safe Return to Work, Policy 4.15. This is our Early and Safe Return to Work program, and the policy is located on our hub. This policy takes place when an accident or incident happens and an employee is unable to return to work. This can be something minor like the repositioning that we just spoke about, or it could be something more severe like a fall where you hurt yourself. You can find the package in our hub and fill it out according to your position within Rygiel Supports for Community Living. Complete the package and bring it to the office as soon as possible. Once the package is completed, you will be asked to come into the office to speak with Human Resources. This will be a WSIB claim, and we will submit a form to them within 3 days. We will meet with you and discuss a return to work plan and schedule regular meetings with you until you fully return to work. Communication. Team meetings is one way you can let your team know potential hazards and work together to keep your location safe. At monthly team meetings, inspections and near-miss forms will be talked about with your team. You can provide feedback and solutions to our health and safety rep or by asking for information and discussing issues in the home. It is the responsibility of all employees at Rygiel to work together when reporting, solving, and preventing workplace safety issues. This is a way for us to collaborate and work together to solve and prevent issues. Using the internal responsibility system, we can all work together to make Rygiel Supports for Community Living a safe and healthy place to work.